The topic is necrosis. This topic includes definition, different types of necrosis in detail. Definition. Necrosis is the localized area of death of tissue followed by degradation of the tissue by hydrolytic enzymes and is invariably accompanied by inflammatory reaction. Types of necrosis. Coagulative necrosis, liquefaction necrosis, gaseous necrosis, fat necrosis, fibrinoid necrosis. Coagulative necrosis. It is the most common type of necrosis. Occurs due to a sudden cessation of blood flow, seen in the heart, kidney, and spleen. Gross appearance. Early stage appears as pale, firm, and slightly swollen area. In the later stages, it is yellowish, softer, and shrunken. Microscopy. Hallmark of coagulative necrosis is the conversion of normal cells into their tombstones. That is, outlines of the cells are retained so that the cell type can be recognized, but their cytoplasmic and nuclear details are lost. Eventually, the necrosed focus is infiltrated by inflammatory cells, and dead cells are phagocytosed, leaving granular debris and fragments of cells. You can see the diagram of coagulative necrosis. Liquefaction necrosis occurs due to ischemic injury and bacterial or fungal infection. Hydrolytic enzymes have a dominant role in causing semi-fluid material of liquefaction necrosis. For example, an abscess and infarct of the brain. Gross appearance. It is soft with a liquefied center. Later, a cyst wall is formed. Microscopy. Cyst wall is formed by proliferating capillaries, inflammatory cells, and fibroblasts. Cystic space contains necrotic cell debris and macrophages filled with phagocytosed material. You can see the area of liquefaction necrosis. Gaseous necrosis found in the center of the foci of tuberculous infections. Combines features of both coagulative and liquefaction necrosis. Gross appearance. Resembles dry cheese and hence the name caseous. Appears as soft, granular, yellowish area. Microscopy. Center of the focus contains a structureless eosinophilic material. Surrounding tissue shows characteristic granulomatous inflammatory reaction consisting of epithelioid cells, Langerhans giant cells, and a peripheral mantle of lymphocytes. You can see the central area of caseation necrosis followed by chronic granulomatous inflammatory reaction surrounding the central area. Fat necrosis. Seen in fat-rich locations, for example, traumatic fat necrosis of the breast and acute pancreatitis. Gross. Appears as yellowish white and firm deposits. Formation of calcium sorbs gives a chalky white appearance. Microscopy. Necrosed area has a cloudy appearance surrounded by inflammatory reaction. In calcium sorb formation, seen as amorphous granular basophilic material. Fibrinoid necrosis, characterized by deposition of fibrin-like material, seen in immunological tissue injury, arterioles in hypertension, peptic ulcer. Microscopy. You see a brightly eosinophilic deposition which is surrounded by nuclear debris of neutrophils. Thus, we have seen that necrosis is a localized area of death in living tissue accompanied by inflammatory reaction. Coagulative necrosis is caused by sudden cessation of blood flow. In liquefaction necrosis, hydrolytic enzymes play a dominant role. Caseous necrosis is found in tuberculous infections. Fat necrosis is seen in the breast and in acute pancreatitis. Fibrinoid necrosis is due to immunologic tissue injury. Thank you.